France. And it's my pleasure to welcome you and also to welcome our distinguished. The subject of today will be the lips treatment based on hyaluronic acid injections. So it's my pleasure to welcome in this webinar Dr. Marcin Ambroziak from Poland. Good evening. Marcin is a well-known dermatologist working with Vivacy for a long time now. So it's always a pleasure to see you. So you will represent, in fact, the dermatologist's vision for this kind of treatment. And we are also very pleased to welcome Stefan Marito from Switzerland. Hello, Stefan. Stefan is a plastic surgeon. He's based in Geneva, and he has also huge experience in this kind of treatment. So as you can see on the agenda, we will begin the first introduction from myself regarding the product of the Vivacy range that are used in the lips treatment. And then Stefan will make an overview through a very nice presentation with short video sequences in order to present you the effect of those lips treatments. And then we have that Dr. Ambroziak managed to recruit 2 patients. So we will have, after that, 2 live demonstrations from Poland. Hopefully the technical aspect will be perfect, I hope. And Marcin will, of course, comment what he's doing the treatment. And after that, and please don't hesitate to write down your question inside the chat. I will publish them during the demonstration and the presentation, and then we can have half an hour after the presentation. Without waiting, I'm going to go back on my shared screen just to do an introduction regarding the Stylage product that we are using in this area. So maybe you for some of them you are already knowing this presentation, but it's logical because it's the only way that when we are developing a product, we are always doing the same. That we are trying to feed the space between the technology that we are using in the lab, your questions that are usually related to the safety of the product and also the clinical effect. So in Vivacy, we are convinced that if you are defining the mechanical behavior of your product, if you are defining that carefully, then a good compatibility with the injected tissue that you have in mind. And if you are managing to do that, then you can speak about, you can talk about integration, the biointegration of the product, which will drive definitely the safety and the efficacy product. This slide means exactly what I just said. I mean, the mechanics are here and are very important fit to the tissular environment that you have in front of you, and then have the security and the efficacy. So, about those target tissue, I'm a biochemist, I'm not an anatomist, but it remains that when you are seeing these, I would say, figures, these classical anatomical figures on the face, as a biochemist, my first comment here is that yes, it is really complex and really different. Because of course, when you are looking at the dermoepidermis layer compared to the subcutaneous fat, or even compared to the SMAS, or even compared to the deep adipose layer, definitely macroscopically it's to be very different. So they are dedicated to be injected in one layer or in the other one, it should be different. So we will try to decipher a little bit more of those differences. And of course, since the subject of this talk is dedicated on the lips, it's this slide is illustrating also what I was saying. Layers are obvious. Every part of the faces. It's also true in the lips, because as you can see here, we will find the dermoepidermis layers. Then we will have also some fat. Then here you have 2 layers of muscles, and then here you have some glands, and then the mucosa, the internal mucosa. So it's also a very complex structure. So and it's important for us as a manufacturer that in order to be able possible product for this such a very specific. Yeah. And if we are zooming on those tissues, and especially here, you are of course recognizing the epidermis, the dermis, and the hypodermis. What does it mean? In fact, if you are looking at the epidermis and the dermis, here you are seeing that it's very dense. It's full of fiber. What you are looking here are mainly collagen and elastin fibers. The thing is, when you are looking at from a mechanical point of view, it's obvious that it's very dense. If you are focusing on the fat, if you are zooming on what is exactly the fat, in fact, it's made of adipocytes, big cells, full of fat. What is interesting is to look at extracellular matrix, which is not dense at all compared to what we just saw in the dermis. So your product should be adapted to the environment that you will inject in the fat will be necessarily completely different than the product that you are injecting in the dermis. So trying, and if I can give you some clues about the really important mechanical properties that you should have in front of course the tissue that I mentioned, and extracellular matrix, the loose extracellular matrix, and of course you have some intermediate here. The property that you should have in mind in front of that is the viscosity. And just to give you an example or an idea or what I have in mind when I'm mentioning the viscosity, you will understand immediately that a viscous product will stay exactly where you are putting it, while a non-viscous product will have the tendency to spread. It's obvious, and of course here I put also on this graph all the products that are used as treatment in the Vivacy range. So obviously, when you are dealing with a very dense tissue, you should have a non-viscous product. While when you want to deal with a non-dense tissue, you should have a viscous product because you want your product staying where you want to inject it. That inside the Vivacy product range, there is a consistency that when you are increasing the level of the product, of course you are increasing the viscosity. And the other very important parameter that we have to keep in mind is inject superficially or will I inject deep? Because the problem will be completely different. If you are injecting superficially, maybe happen for the lips treatment, you don't want to have at the surface lumps and bumps. So you do not need to be too much elastic. Now looking at what is exactly the elasticity. Elasticity, in fact, is the ability of a product to counteract the pressure. It's a resistance to deformation. Here you don't need because you are very superficial. But as you are to inject deeper and deeper, you need to increase a little bit the elasticity. Of course, not too much, because if you are too much elastic, again, lumps and bumps, and especially in those very subtle and very delicate area that we are talking about today, which are the lips. So elasticity should be definitely linked to your injection. This is my take-home message. The elasticity are really two important parameters from a clinical point of view. And again, regarding the of the Vivacy product range, you can see that the more you are increasing the level of your product, the more elastic you will be, of course. And this is a reminder of the whole of the overall overview of the Stylage product range. So, and here are theoretically the product that we will use for the lips treatment. And of course, after that, it's a physician choice. We have here the ability to fine-tune with very close product that you can use for this part or this part of the lip treatment. So I think it's an advantage to give you this kind of choice. At my last slide, because it's just a resume of what we said. The rheology is here and it's important, but you do not have maybe even if G prime or G second or those parameters are still pretty difficult to understand. It's easy to think about those elements, the viscosity and the elasticity, and because of that, you will be adapted to the tissue. Because of that, you will be secure and efficient. Of course, it's important to know when you are that in the factory we have many parameters in order to play with, in order to be able to propose you different kinds of products. This is not the subject of today, but in mind, this is the fact that we are mastering the different consequences of all those parameters that we are able to propose you something as consistent as we are able to. So your attention, and it was not. So I will give the stage now immediately to Dr. Smarito, who will make a presentation about the specific indication of the lips. Thank you. And Stefan, the stage is yours. You can share your screen.
Okay, thank you, Dennis. I just connect. Yes. Okay. So I think it's okay. Hi, I'm Dr. Smarito. I'm a plastic surgeon in Switzerland. I am very happy to be with you today. We're going to talk about this fantastic subject, the lips. And so first step, we will talk about anatomy, few minutes. What is the perfect lip? Risk area, injection, and also we will talk about Instagram. Then I will explain you why Heishe is my first choice, and after I will do with you some before and after injection, and with 4-step volume, dermium border, wrinkles, and something that I call profiloplasty or full face. So the anatomy, first step. Let's remember some different things about lips. Here you have the philtrum, very important for me, the cuspid bow, the tubercle here, the upper vermeil border, lower, okay, the sulcus, oral commissure also, and many times the best is to have 1 centimeter on the upper lips and 1.5 or 6 for the lower lip. So when you have a patient in your office, it's very important to first see the profile of the lips, because they can give you some indication about what kind of products you can use and is it a problem of volume. And I would like to remember you that lips is also smile. Here you have the classification with type 1, type 2, and type 3 smile. It's very important to picture and to see what happens when the patient smiles in the office. So the anatomy. Okay, here on the left, you have the injection layer. What is very important for us, it's the artery. Okay, it's here, and you can see in this lower left that the branch of labial artery is here. So if you know that, there is no lot of risk during the injection of the labia minora, of the labia. I do a lot of labiaplasty, that's why I made this mistake. So we have to check the artery here. Okay, it's another border, and we make some dissection with cadaver with Dennis, and you can see the true position of the artery on this not so fresh cadaver. Many times we forget the veins. It's very important to understand because it's with the vein that you have some hematoma after the procedure. Okay, I can ask you a question. Is there fat inside the lip? I'm not sure there is a lot of fat inside the lips. We made also a study with injection with cannula and needles, and when we do the injection, most of the time we are inside the muscle. So, of course, as said Denise, there is the mucosae, and you don't have to inject inside the mucosae because you will have this awful effect. So for us, it's quite easy to understand what is beautiful lips. I would like to talk about light and shadow, but for your patient, we can see this fantastic publication of JAMA. The patient and the public thinks that a very sexy and gorgeous lips is a big lip, and it's better to have this ratio here. Okay, so when they finish the publication, they say that the best lift is like this and like this. Okay, so I would like also to talk about Instagram because now there is a lot of influencer. We talk a lot about lift for cosmetic and of course injection, sometimes with beautiful results, like this in UK and I think in the United States. I do also some publication, and sometimes there is horrible results. So you must, in my mind, ask your patient, can you show me with your iPhone what does you want? This is one of my passion, and you never know if your patient is influencer or not. So this is a part of the anatomy. Okay, hyaluronic acid, very easy. It's my first choice, of course. I stopped doing lipofilling of the lip. We know the molecule. We know that it's non-animal origin. It's safe, and we made millions of injections. With Vivasi for the lips, I use the hem, not so often the hairs, but also the hydro, and of course lips. So, first step, lips injection, please. If don't take photo of my patient, please. So for the lips and volume, I use M lips and lips lidocaine. At the beginning, I used to do a local anesthesia, but I stopped. And this kind of device can also be very good. So you can use needle or cannula. It's not a problem. In this case, I try to do some volume to this patient, a young patient. Also, you have to see that it's a concave profile. So I do more volume with hand, okay, with a cannula. This is for volume. Sometimes the patient wants more volume. It's very important to do a very good speed bow. So you can draw it before the injection. You can take time and also to show to your patient what you want to do. Okay, go on with this. So this is an example of injection. Okay. Usually I do the injection very slowly, and I will show you one more time this kind of injection. So here we make volume, and as you see at the end there is a light on the border of the lips. Okay. Okay. Another case, this patient also you see she has a big upper lips, and she doesn't want a lot of volume. So I made it with lips, and the product is lips with lidocaine, and I do the injection also with a needle. another kind. Okay, this is with a cannula. When you use a cannula, in my experience, you are always inside the muscle. So for me, cannula is better for volume. We can talk about this with my friend just after the live, but you can switch middle cannula. But when I want to do volume, usually I use this kind of device to do that with a cannula. Okay, sometimes patient want more. I'm not. Many times I say no to the patient because young girl sometimes want something very big, and I don't want to do that. In this case, of course, we can do more on the. I do a lot on the upper lips, and I try to do more, but the patient say no. Okay, another case with the volume, very easy. Okay, you put some volume, and also you can draw the border of the vermillon. I made a study with lips and M. We have a long time effect. I am very happy with the product because many years ago I used a different device, but I stopped. I only use hem and lips because I am very happy with an effect about, I can say 8 months with hem, and with lips it depends on the patient. We can talk about this after. Sometimes the patient come with a precise idea. So yes, I used to say to the patient, and also the young patient, yes, can you show me what you want? So many times the patient has some idea and have some photography in their iPhone or Samsung. Okay, here you see we can use needle to do a volume, and it's very efficient. So usually I do that slowly, and now many times without a local topic anesthesia. Okay, this is the result of this young girl. Something very important for me, it's always the first step of my injection is the cuspid bone. With a mistake, it's bone. Okay, this is the JICA point. You can also do that at the end of another part of the face, and it's very easy to have a beautiful cuspid bow. Just 2 points of injection, and sometimes also it's a beginning for lips in the injection. It means that sometimes patient doesn't want. You can say yes, I can do something, and they are very happy with this because it's quite easy, it's not expensive, and we have a good effect with a very thin volume of product. So it's very important to do that. The vermillon border. Okay, so you see this beautiful model with a very thin upper lips. And in this case, it's only injection of the filtrum and vermillon border with needle. With this kind of effect, I think it's the beauty of injection is the border. Okay, this is another case, volume and also border. This patient made a rhinoplasty with me. So after she decided to do their lips, and she has beautiful lips, but we can enhance this with more sexy aspect. And so before we can check, in this case, she has 1 centimeter upper and 1.5. And so it's a matter of volume, but also of the border of the vermillon. So you can explain her, make a drawing. In this case, you can see that the profile, it's not so bad, but with you can feel that with a little volume, you can have something beautiful. So we made it. In this case, I use a cannula, and then I am in the muscle, and sometimes also I switch for more thin cannula to do the border. It depends. Okay. One more time, and I do that very slowly. You can open the mouth to be sure. You can touch with your finger to be sure of how deaf you are. You can test, you can see. And at the end, this is the result. Okay. So the profile is better, and you have a very good border with a sexy aspect. And okay. And the light, as I say, lip injection is a matter of light and shadow. The patient is happy and she comes every 6 months. It depends, with at the end a good result. Another case, she wants more volume, so I put on the two lips and border with some volume. Okay, this is difficult cases for asymmetry. When you have asymmetry, it's quite difficult. So many times asymmetry, you have to inject inside the muscle to do volume on parts and little touch to have a good finishing. So that's why I made that for this girl with this kind of result. The same, a little asymmetry. Okay, I do it with the needle in this case because I injected only one side. Okay, you see, I begin with the GK point. Very easy. And also you have to do that slowly because there is anesthesia inside the product. So when you take time, it's more easy for the patient. Okay, and you see a little edema on the right side, but it will be fine after three days. The wrinkles, in this case, I use layers also, and also skin booster, hydro. So it's very easy to inject, bleaching technique. Also quite the same cases, but in this case, sometimes it's okay, or you will have a better result also by injecting the border. One more case, this is the result. Okay, not too much. And I love to do that. It's profiloplasty of full face. You can use S, you can use M, L, because you do all the face. In this model, we made a injection for the nose, for the lips. So you have a good effect. A lot of product, as you see, but with an incredible effect for the profile. I hope that we can do in the future more webinar and workshop. And this is also a profiloplasty, injection of the nose and a small injection of the lip. And you can see the effect of the profile with this. Okay, you can, I must hurry up to give time to live, but you can see this video on the Instagram. So one more time, you see this is the end of the injection of the nose. And here I begin with GK point and the border. Okay. It's quite easy. Usually, if you go slowly, the patient doesn't have pain. I check one more time the noise because I injected all the part of the noise in the middle to avoid problem with artery. And now, go down. Easy, slowly. And with this kind of injection, you see just before we can have this kind of beautiful result. Thank you very much. Now I think it's time to the live.
So thank you, Stefan. If you can stop the sharing of your screen.
Yes, of course. And I think I cut the microphone. See you just after the live.
Okay. So you're right. Now it's time to Marcin to explain you to explain us in live and to show us the techniques, different techniques on two different patients in live. So Martin, the stage is yours.
Yes. Thank you very much, Stefan. That was a very interesting presentation. I hope we'll have a few minutes to discuss the whole techniques, because as you know, every treatment should be tailored individually, But I was thinking about our attitude towards lip augmentation, and I think all the offices around Europe are hitting more or less the same expectations of patients. So I thought that we could divide expectation of lip expectation of our patients to the two kinds of techniques. We call it French kiss or Russian lips. Yes. You can start using your imagination. Oh, yes, Stefan, you're right. But on the other hand, it is not only the matter of volume and the number of syringes that you give. Because as you mentioned before, if we have a problem with small lips and everything is gone in my screen. Okay, you're back. So if you have a patient who wants to have just bigger lips, you can use Stylage M, cannula 25G, and you have no bruises, you have immediate effect, a little swelling, and just giving the volume without changing of the profile or changing of the shape of the lips. But French kiss is the solution for the lady who's coming to your office and asking, doctor, I want to go to work tomorrow. I'm wearing suit to my office and I don't want anyone in this office to notice that I already been injected with the hyaluronic acid in my lips. So we are using in such cases mostly special lips because it gives you a very gentle effect, not too much of the swelling, not too much of the hydration of the lips afterwards. And on the other hand, you have a patient who wants to look sexier, and she doesn't mind a little bit of exaggeration, or because this is the method of this Russian lip technique, it enhances the red part of the lip. So if you have a patient who has a very definite contour of the lips and flat part, red part of the lip, then you may use this Russian lip techniques. So for today's workshop, we have two patients. Thankfully, we are working for 2 weeks now. I will have to use my mask because this is the requirements of the state. Especially our patient has no mask for today. And the first patient is going to she has very nice volume of the lip with a definite contour and quite flat red part of the lip. So we will inject only with the needle, Stylage special lip. I will give her a few injections into the contour, maybe 2 dots in the tip of the cupid bow, the same on the other side. Then parallelly to the vermilion border, we'll give another few shots, super tiny amounts every time, into the red lip, just to give a little volume into the red lip. Same in the lower lip, vermilion border, using needle, and parallelly, but in the central part, giving some volume. Okay, can we see our patient? You ready?
Yes.
Okay. Afraid? A little. Okay. You should be a little bit afraid.
It's my first time.
This is first time?
Yeah.
Okay. You have very nice lips. But they look dehydrated. They don't have a definite vermion border. And maybe if we don't use, because she has very nice lip. I mean, in the terms of the volume. So we cannot add too much. I will use probably 3/4 of the syringe, and the rest I will inject into the oral commissures to lift the angus of the lip. Okay. She's already disinfected. We could use a cannula, 25G cannula, starting from here to inject the red part of the lip. But then, this is more precise, I think, especially for the contouring of the lip. Slowly, gradually, giving a little amount of the gel. How was it? Not bad. Not bad. Again, slowly, not too much. You could see moving of the product inside the canal of the vermion border. Okay. And that part. Parallel. Okay, those masks, because my glasses can become foggy. Okay. Lower lip, shame. Blood. A little bit into the canal. It's quite easy, I must say, to enhance something which is what is already beautiful. Okay. Still right?
Yes.
Okay. Let's change sides. Okay. No. I was a little bit. This is not a new technique, but it's still working in most of cases. I'm trying not to be too deep. Let's say 2 millimeters parallelly to the contour. Okay. Lower. Into the mouth. And up to the commission. And parallelly into red part. The last thing almost, probably, let me look at your lips, whether they are symmetrical. Okay, we'll give you a little shot. It's even less than 0.1. It gives nice definition of the lips. A little bit more. Okay. Okay, I have used 0.6. Now, the absolutely easy technique to lift the commissures. I'm getting small small is 0.1 into commissures. Another one. If you have like 0.2 left in the syringe, it's quite enough to leave the commissures of the lips. And massage, and we are ready. How was it? 0.10, 0 to 10 in terms of pain.
No pain.
No pain at all?
No pain. Really, it was.
We're cheating a little bit because she was, I don't know, almost an hour sitting with the anesthetic gel. Little massage, which is essential not to have any bumps. Sorry, I have to. Maybe that'll be less foggy now. Today in Thailand, cosmetologists and hairdressers can open their shops eventually. So we are getting to normal step by step.
You had a question.
We opened the clinic fully for the patients 2 weeks ago, and I must say we have plenty of patients, hungry as wolves for the aesthetic procedures. Okay, wipe it off. Would you look into the camera? So our patient is a little bit swollen. It should, I think we need, yeah. The lips are swollen. The swelling should go away within 12 hours. She was bleeding a little bit, so some bruises can appear tomorrow, but not too much now. I can't see any. How long it will stay with you? I don't know. It depends on your own hyaluronidase, the enzyme that
I hope I
destroys the hyaluronic acid. Yeah, but hopefully you will see each other in a year. Okay, we have now time for the next patient. Thank you.
Thank you, Marcin. And
Waiting for the next patient. I can
that
show you the results of the questionnaire that we asked our Facebook friends about the technique that they really like and the products for lips that they are usually use. So astonishingly, because we published this yesterday probably, more than 100 doctors took part in this survey. I show you the next one. Next slide. So we asked which technique do you usually use in your practice. So 65% of our friends are using French kiss technique. So most of the patients who are coming to the office, they ask for small, very delicate result. Only 35% like the Russian lips, which is probably the same in my office. Though I'm trying not to judge ever patients, because if they come to our place and they asking for bigger lips, I'm trying not to judge, but just to do my job as well as I'm able to. Next, please. And the product that is mostly used, at least in Poland, 70% of our friends are using Stylage M, which is not surprising for me because it gives very nice volume. It is very plastic. You can palpate very easily. It doesn't give any bumps in the lips. It doesn't give a prolonged swelling. It's very, very handy. 30% of the Stylage special lips is a little bit on the contrary to the expectation, though. If majority of patients are asking for French kiss technique, so the doctor should use a little bit more of the Stylage special lips. But everyone has his own techniques that they like and products. Okay.
Marcin, do you hear me?
Back my mask. Thank you for this presentation. Stefan, what are you handling? Okay. Okay. So another patient for today. As you could see, the patient has very nice and quite big lips. She was injected last time 2 years ago. Since that time, it's probably nothing's left in the lips. Probably. And when I asked her what type of lips do you want, she said big. Yeah, why not? Let's do some big lips. So the technique that we call Russian lips is based on vertical injections from the contour of the lips, from the vermion border, one by another, super small amounts of the gel, mostly using Stylage M, because it gives nice volume and it's soft. Tiny vertical injections. You have to be very careful to be all the time that you inject on the same level. Let's say maybe about 1 millimeter deep. Sorry for this. I'll try. Yeah. Vertical injections. Then we do the other side, same. Tiny vertical injections starting from the vermion border. Then we add a little injection from the commissure to continue this augmentation, make it smooth line of augmentation. Then we check the tips of the Cupid's bow. Then we go to the switch to the lower lip, and we're doing quite the same. From the contour to the red part of the lip, super tiny injections, mostly in the center of the lower lip. Then we do one from the side to have this nice curved line, and that will be all. It is maybe a little bit more painful because of the number of injections. It will be swollen for a longer time than the French kiss because of the number of injections, but it gives a very nice, sexy effect. Okay. I have to change the position of the patient because I will be standing behind.
שקט טוב, נעשה גם וידאו, בסדר? תודה מרי.
Chin up. Thank you. I think, let me palpate it. I think I can feel some old injection here. Exactly here. So we'll try to cover it with the new one. Okay, ready? slowly. Tiny injection. Parallel. Slow. I'm trying not to breathe to not to make my glasses foggy again. So annoying. You good? Painful? A little. Women are amazing. Really. A little bit more here. Okay. Another side. For this one, I cannot go too deep because this is an old one. An old product, I think. Okay. We can add some more. She swells fast, I must say. Alright. The peaks of the Cupid's bow, less than 0.1. And the low end. You always swell so fast? You can't answer me now. Okay. I'll ask the same question in a second. Okay, I have to change position. Okay, and closer. Okay. I haven't used the whole syringe. Let me check these irregularities of yours. One more here. Okay. Okay, so the patient is really swelling very fast. It is not going to be that big. It was quite difficult, I must say, due to those old debris of the product. it will be gone. I mean, the swelling will be gone by tomorrow's lunch, probably. Until that time, you have really big lips.
Marcin, do you hear me?
Okay. I think we are ready with the lives.
Marcin, do you hear me?
Can we show the comparison of the pictures? Is it possible now? Okay. We can start discussion. Probably our tech guys will be ready to show us before and afters in a few minutes.
Okay. Project, do you hear me? Okay, hear me? You are hearing me. Looking for the sound connection. Don't project. So that we can start the discussion with him.
I switch on my microphone. Is it okay, Denise?
Yeah, no problem.
Okay.
I'm just waiting for. Yeah.
Okay. Just before Abdel check for this little problem, I have advice for our friends. Okay, that's why I moved during the injection, because it's to prevent fogging of the lenses. It's very important because when we do injection, it's very difficult with this horrible mask and our glasses. Yeah, of course. But also,
normally I use this one, but
yes,
they couldn't take pictures.
Yes. But we don't know the future with this. I hope it will be okay in a few weeks. But at the moment, in Switzerland, I put FPP the mask, and I buy this. I can put it in Instagram. It's very easy to find because it's not for doctor, and you have this here, and with this you don't have fog. So it's very special, but it's very efficient to do injection. I think it's okay now for.
Okay. So Martin, I guess that you are hearing me. So I will start with in the temporal order of the question, because there were many questions during either Stefan presentation and Martin injection. The first one is, while injecting lips, which area you need to be superficial and which area you can be deep in order to avoid complications, please?
I think the basic rule is when you want to be deep, use cannula. If you want to go superficial, you can do it with cannula when it's thin or needle. Doesn't matter. But in terms of safety, you have to be deep with the cannula.
For the anatomy, if you are in the border, there is no problem with artery. We know very well that with surgery, because with flap we cut the lips. So if you are on the border, think that there is no problem. So after, if you go deep, yes, I think it's better to use cannula also. We are not sure with the risk of artery, but I think it's better also to do that. And if you go 1 centimeter inside and you go like this, I think you can hurt artery. So it's, of course, for noise, you have to be very careful with anatomy. For lips, it's not a big problem. The border, no problem. Few millimeters down the border, no problem.
Okay, thank you guys. The second, then there is a couple of questions regarding the Cupid bow treatment. During inject the center part of cupid bow, decay point, I guess it was related to what you were mentioning, Stefan, inside your presentation.
Yeah. Marcel, okay. Yes, many times. I think that's one of very important thing in Switzerland. And in my office is cupid bow. So I begin with what we call check-up point, also for anesthesia. So inside the red lip, and after I can go, so I go like this inside the lips, and I do it, wait, many times I go down, I change the area, and I come back with the line here on the cupid. So I put inside the bolus, weight, and the border. And after, I come back and do the filter.
Yes, depending on the patient, because
Yes, of course.
if the question was whether we inject here, we can do that, but the cupid's bow stops to be a bow anymore because it becomes a curved line there. There is a type of lip that the patient wants. Yeah, big upper lip, enormously big with no cupid bow in the center. Then we can inject here.
Okay. Fan is writing something because we are hearing everything. Thank you. Then, what is the best filler to give a nice shape to lips, but not necessarily make them bigger?
Lips, special lips with lidocaine.
Or when we talk hydration of lips, then maybe S.
And if I can add something also related from the industrial lips was originally designed. You know, it was maybe a matter of culture of the company, which is seeking naturality historically. But lips is definitely not something that will naturally give you a very high volume because of its slight elasticity. And of course, given also the market tendencies and things like that, nothing is put in the concrete. You know, we're still thinking about the what kind of development that we can put on the market, and this aspect of things is definitely that something that we have in mind. I mean, we are seeing here that M is really appreciated in order to lips area. So we are thinking about something in between or closer to M. Next question. It was related to the explanation of the Russian lips, but Martin, it was before your demonstration, so I think that the physician who asked that has many details. The next one was interesting. Need of aspiration or not in this highly vascularized?
To be aware of the fact that once you can aspirate for the first time, because then the gel is inside needle and you will not aspirate even when you are inside the artery. So it's just impossible.
It was my microphone. Do you have any comment regarding the aspiration?
No, I never do that.
If I may, there are some papers.
But sorry, Dennis, the true question is, do you have a nurse with you when you do that? This is the question. The because you can do this alone or with your nurse. I think it's fantastic to have a nurse because she can, of course, do that, but also many times the patient look at the nurse and she can say yes, no, and we can do injection of a lip with a team. And I want to say that I change some injection of point of injection after injection when my nurse say, doctor, I think that. So one of the occasion is I think it's better to do that with a team.
I just wanted to add that there is now a lot of papers on PubMed dealing with this aspiration effect. And just to add on what Martin says, yes.
Have you heard what I've said about the aspiration?
Yes, of course. When you mentioned the fact that you should do it the first time.
The next time has no use because the product is inside the needle, right?
It was exactly what
and of course you have to have your nurse and hyaluronidase in your fridge.
Of course. That said, we have a question regarding the hyaluronidase. How long does it take for hyaluronidase after injection to get rid of the filler from lips? In other words, do you see a difference? The hyaluronidase is acting between the lips and other parts of the face.
It's 6 hours. According to a publication, it devours, in 6 hours, it should devour all the product that we have injected with this enzyme.
Do you have some experience with hyaluronidase usage in this area?
Me? No. Also, it's quite different with noise injection or injection in this area or here. Of course, we have to be very careful. Not so afraid with the lips, and I don't have any experience of this. Of course, you need hyaluronidase in the office. Hyaluronidase is also a subject. We can do a webinar of 2 hours about this.
Say something again about hyaluronidase in the lips. There are different indications for this enzyme usage in the lips because I think in 90% of patients coming to our office for hyaluronidase, they still have some residue gel from another injection sessions. Like they have submucosal nodules, they have asymmetry, they have all types of aesthetic side effects. I never had in my practice a vascular side effect in the lips, so I should use hyaluronidase in this area. But I was talking to my Polish friends who experienced the immediate whitening after injecting hyaluronic acid in the lips. So you can never be so sure about your safety. Remember that 30% of patients has anatomy different than this in Atlas.
Thank you, Martin. Next question. It's related to the anesthesia protocol that you are using, of you. So maybe Stefan, you can begin. What protocol are you using for this area?
Also, it depends what kind of injection they show us. For a small injection of a border, it's painful, but I like a surgeon, I used to do local anesthesia, topic anesthesia, but I stopped to do that now in my office. Many times I can put a little of EMLA cream, but not a lot. But many times now I don't do anesthesia, but I go very slowly, and I've got I begin in this part, wait, change, come back, because I wait for the effect of the lidocaine inside the product. So not a lot of anesthesia nowadays for me.
Martin?
I must say that 90% of our patients are asking for local, and we're using lidotetracaine ointment. So it is working much faster than EMLA, much stronger than EMLA, and I never had any side effects apart from maybe little swelling or little redness. And the rest, this remaining 10%, they are asking for dental anesthesia.
Thank you, Martin. I'm allowing myself, because a question arrived just after our discussion on hyaluronidase. The question was, is hyaluronidase able to destroy either exogenous or endogenous HA? The answer is yes. Hyaluronidase, it will destroy the product that you will inject, but also the endogenous HA that is present in the tissue. So you need to use it very carefully. Next question. Increase the chance of side effect. Do PRP mesotherapy treatment together with lips on one visit? The first question is to ask you, what is your view of the PRP mesotherapy usage in this area?
Same area, same time? I don't. I never use that because it's another injection, another swelling, another. When you use good products like Stylage, you don't have to bother the side effects, or you have to always think about it. But when you use good products, you don't have to add some PRP. This is my opinion.
Stefan, don't forget to unmute your microphone.
Okay, this is a special focus because I'm going to talk about stem cells, about niche, about PRP, and also at this time of science, I think it's quite difficult to do inside many things. Hyaluronic acid, PRP, why not stem cell, adipose stem cell? So, no, I don't understand why you need that, because with hyaluronic acid is so easy, so efficient for everything, hydration, volume, high definition of a border. For me, it's enough. I can talk about stem cell also because my clinic, we do a lot of stem cells. We make now a mistake to mix everything. It's a trend, but we must think about the cell and the niche of the cell.
Thank you. Regarding the moisturization of the lips using Hydro or Hydromax, can you give us a few words about that? The depth that you are, if you are doing it first, and if yes, what is the depth, the tissue depth that you are talking?
Me? So I'm using Hydromax just for, as Stefan mentioned, only for augmentation of small wrinkles in the upper or lower lip. Because you have to remember that every hyaluronic acid gives you this effect of hydration. So for me and my patient, I think the product of first use is Stylage S to make hydration, especially that if you use Hydromax for the lips only, the swelling is a little bit longer than in S, for example.
I confirm it's dedicated to green water. Stefan?
Oh yes, I agree with this. Nothing to say more. Yeah, I use it, But you have to think it's 1 month, you come back 1 month later, 1 month again, and so you make 5 times during 6 months with Hydro. Many times I don't use Hydromax. And it's very, yes, mesotherapy needle, and very thin like this. And sometimes there is a swelling after. Yeah.
Then I have a group of questions regarding marching Russian technique. So if you don't mind marching, can you give us a reminder and especially of this technique, and especially the first was, we need to inject from the vermilion border by border. And the second question was related to what you mentioned, the super tiny injection. Do you have an idea of the volume and how far one from each other? But I guess this is depending also
Let me find this. First of all, I'm quite disappointed with this patient because she swelled so fast and so much that it didn't give you the right impression of the technique, that it is really, it gives you really nice sexy lips, and this second patient had just terribly swollen lips. So sorry for this. This morning we've done another 2 patients, so I hope they will be also available on the Vivas side, and it really gives super nice effect depending on the volume, of course, that you are giving. So coming back to this Russian technique, you start from the vermilion border, going down one by another, parallelly one to another, and for one injection I'm giving less than 0.1. So always calculate that for those injections you should use not more than 0.2, because you're planning to give 1 ml for the whole lips. You have to do those injections, this side injection, another side, points on the cupid bow, and the lower lip. So if it is 0.2, 0.2, 0.4, we have something left for those points.
נלחמת לי מרק, את רוצה נטע? אתה רוצה מרק?
I would like to say something. Thank you so much, because
it's
so difficult to do live surgery of injection. So thank you for this, because we know that when we do congress all over the world, it's very difficult. And so merci beaucoup, merci.
Oui, Stéphane. Yes, twice. A question from Israel. Do you use preventive treatment for herpes, eventually herpes crisis triggered by this kind of treatment?
So if the patient is prone to have herpes infection, they are asked to use acyclovir tablets before coming for lip augmentation. We always ask about it during the session. If the patient experienced herpes for last 2-3 years, then we are giving tablets. Mostly should be taken 1,000 milligrams per day for a couple of next days. Remember that the acyclovir is working in very short time, so patients should have it 5 times a day.
Thank you. Now regarding the needles, what kind of needle are you using when you are doing the Russian lips? Gauge or even maybe lower?
The size of the lips, because today's patient, she had very big lips, so I used the needle, 30 gauge needle. It's probably 13 millimeter long, the one that is packed together with a stillage. But if you have smaller lips, you can use Mesorelle 4 millimeters, and then you'll be maybe for first few patients more safe with this technique, because you will always place the product on the same distance, because this one will be always 4 millimeters.
But I guess the answer is pretty obvious. Would you suggest Russian technique for contouring or to create volume?
Mostly for creating volume, but you have to remember that if you want to add volume without changing the shape of the lips, then you have to use the 25G cannula together with the Stylage M and give it 1, 2, maybe 3 times like a fan technique inside the red lip, and this is the technique for the volume. The Russian lip is to change the profile of the lips to give more convexity of the red lip.
Question related to the potential usage of Botox together with the filler to flip. Maybe you have.
Yeah. Sorry, you hear me? Yes. It's okay. Yes, you can use it. 2 points. 1 here, 1 here. That's all. I do that before the haché if I have a wrinkle here. Not too much, because you can have a sagging, but 2 little points here, yes. And after he draw S or sometimes lips, special lips.
Interesting. It's a question for Martin. For your dental anesthesia, do you orbital block? What is your technique preferred?
I don't like blocks. I'm injecting 3 points between I'm not a dentist, so I have a problem with anatomical terms. But I'm injecting in the just above the teeth, between the gum and the mucous membrane of the lip. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3 points. And I prefer giving Lido, pure Lido without adrenaline, because it lasts for 15 minutes, maybe 20, and next 30 minutes they can go and have coffee. If I inject them with a real dental anesthesia containing adrenaline, they are blocked for another 2-3 hours. They really don't like it.
Yeah, Stefan?
Okay, very interesting.
Okay.
I will try.
Another question related to this time the French is use the classical French technique to get big lips with cannula in order to avoid so many injections and maybe bleeding. I think that you can be superficial with cannula if you pinch the lip. A comment or an alternative to the technique that you described. Any comment?
I can say yes. It's a fight. Usually it's a fight, needle or cannula. But I think it's not a fight. Because first of all, you have to make a choice. The base choice is what you have in the hand. So what is easy for you? First. Second thing, yes, you can go with a very thin cannula on the border, but I try to do both, and I think it's easier with a needle. And as there is no risk of necrosis with the artery on the border, I think we are more precise with the needle on the border. Right? Martin?
Yes, I prefer using needle for the more precise injections and the cannula for volume augmentation. But there are different types of cannulas. Of course, those 30Gs are as sharp as needles, so there is no point to use them, in my opinion. But everyone has different techniques. I'd rather use 25 as a safe cannula for volume augmentation, and I do the rest with a needle. But I wouldn't blame anyone for using thin cannulas.
Use much more volume in the proximal part of the lips than in the lateral side. Are you used to inject more product in the proximal part than lateral? Yeah.
In the middle part than the lateral. Everything depends on the patient, because as Stefan said, in the real life consultation or augmentation, we start with discussing what the patient likes. And I always show I just type into Google lip augmentations. They are popping different types of lips, sizes, shapes. And I'm asking, okay, don't tell me what do you want to have, just tell me what you hate. So there are so different attitudes and shapes that patients like, dislike. So you always have to discuss it with the patient. Some of the patients, they want sexy wide sides of the lips, so we inject in the lateral part. Some of them want to be more conservative, and they want to have it injected in the cupid's bow. It's like an M-shaped lip. So everything depends on the patient. I don't do the lips that I like. I'm trying to do the lips that they like.
Comments? No?
No more, but okay. I can say that lips it's quite difficult because the patient have an idea and we have anatomy, but she wants no pain. Sometime a good price. This volume, but not too much. The border, sexy. She wants to come back to her, and husband doesn't need to know that. So it's quite a very difficult exercise to do injection of the lips. But we try.
Regarding, again, sorry, we are going back to the Russian technique, but several lines from one puncture only. So I understand that there were some description of this technique with one entry point and going like that. So Martin, why did you prefer to describe an entry point, several entry points?
Okay, coming back to my drawing. If you do only one entry point and do the fun technique, you will skip the vermilion board, but because because on the upper lip, when you're coming back with your retrograde injection, some of the gel is in the fermion border, so it gives a very nice smooth effect on the whole lip. If I inject it from here, it will be probably some of this smooth shape will be lost. So I'm paying, or the patient is paying more with the swelling for the smooth effect. Good.
Nothing to add to what Martin said. Okay. So I'm just checking at the time. So we are sharp on time. Yes, even if you're in Switzerland. It's time to say hello and goodbye to our viewers. It was again a pleasure to exchange with you guys, and a special thanks to Martin, because Martin took the risk live injection with the camera devices, and technically it was really not easy. So thanks a lot, Martin, for this.
We did backup patients today, so I hope we will manage to show those befores and afters. And I must say, especially for the Russian lips, this morning patient was much better than this evening. And it's always with a life like this.
Yeah, exactly. So thanks a lot to you two doctors, and see you next time. And for those who are still concerned, stay at home, of course.
Cheers. Thank you.